thank you very much. So you were talking about foot care when you are diabetic. Okay, you can go ahead.
Right. So in terms of foot care, what is very important is, let me just go step by step. What is very important is, whenever you take a shower, whenever you finish bathing, make sure you dry your feet properly. They must be dry. Pay specific attention to, in between the toes, and make sure it's dry.
Okay.
Well, that is where we have a big problem. You then might start developing fungal infections. And when those fungal infections develop, they often become very difficult to manage. Remember, we said with diabetes, any infection can become very difficult to manage.
Yes.
So with a fungal infection, you are most likely going to experience a lot of difficulty in managing, managing the wounds that may occur if you don't take control of your feet. Now, the other thing that a lot of people might be doing that I wouldn't encourage anyone to do is, when you're taking care of your feet, don't apply any creams to your feet.
Okay.
Yes, do not apply any creams. Yes, you can use fungal sprays, antifungal sprays. They're quite okay. Just spray them, wait for a few minutes, and then, put on your shoes. Creams, they create an environment that is conducive for fungal growth.
I see.
And they keep in between your toes, becomes too moist at times, thereby becoming a conducive environment for fungal growth as well. So those are the things we need to discourage. And once you have finished bathing and everything, you need to put on a nice shoe that covers, your whole foot in there. The problem with sandals, you can put on sandals, you can wear sandals, but the problem is when you're walking out there, even the smallest stone or rock that can get under, into your sandal, can cause, can cause a wound. It might start as a very small wound, but those wounds are known to cause a lot of problems for most diabetic patients.
Okay.
So it is very imperative that people understand that we need to manage our feet, because this looks light when we talk about it, Beatrice. But the thing is, we've seen a lot of people eventually go for amputations because of that. Diabetic patients are at risk of amputations. And a lot of people have been amputated because their lower limbs have become gangrenous, and they're no longer functional. So what's the point? They have to be cut off in the end. So you might have people who develop wounds in their feet, and then we say, okay, look at this wound. What should we do? We then see, okay, it's only the small toe. Let's amputate the small toe. We take off the small toe. And then as time goes on, because they are still mismanaging themselves, if they don't change the way they manage their feet, you may then end up having a whole gangrenous foot. So in the end, the only option will be to cut it off, amputate. So people have got to really understand that, when you're diabetic, there are a lot of things you just need to be careful about. And the unfortunate thing is, when I look at the environment back, say in Zimbabwe, we don't have people who specialize in these things, who really look into these things with a deeper perspective of, trying to manage these patients. Most people would not be aware of these, I believe there are details that should be available whenever people visit their GPs and everything. So,
I'll just quickly jump in from my experience, being here in the UK. What you're talking about, I don't know if they do it annually or quarterly, but when I go for diabetic care, they test my sensation and how my
Yes.
feet are responding. They use like it almost pricks you like a needle to test if you still have, I think, sensation. But I don't know. I've never had my parents who are living in Zimbabwe ever talking about that. It's just every month it's metformin. I've had so I been recommended for eye tests. There's a specialized one, you know better. There's a specialized one that people who are living with diabetes need to go for. So, but my parents have been living with diabetes for a long time, but they've never had all those.
You haven't had that kind of thing. Yes. So, Beatrice, before we move away from foot care issues, right? People would like to cut their nails, right? When you are cutting your nails, my God, you really need to be very, very careful. You're not going too deep into the nail bed, because if you go too deep into the nail bed, there are chances that you might damage. You might open up a wound in the nail bed, and like I said already, those wounds are very difficult to heal. So this is why you find in the first world, like here in the United Kingdom, we have podiatry services, which help diabetic people, like say, okay, my nails, they need to be cut. They're done by specialists. Yeah, it's not just taking your nail cutter and sitting under the tree and start cutting your nail, because that exposes you to, diabetic foot ulcers. So that's also another area that people really need to be very careful. And I have encountered a lot of patients. We have gone through such things, or say, I just cut my nails and then this ulcer developed. And that is happening to a lot of people, because a lot of people don't know how to manage themselves, unfortunately, due to lack of this education that we are now talking about. Now, we move on to eye care. I'm not an eye specialist, unfortunately, Beatrice, but I can tell you that for diabetic patients, it is recommended that at least once a year, your eyes should be checked. Why? Because we've got anatomically what we call the retina, which is in the eye. So the retina is one of the eye components that helps us see. Okay. Now, the biggest problem, if your retina is affected by poor management of your blood glucose levels, you're most likely going to have what is called retinopathy. With retinopathy, it means you're going to go blind. You probably go blind. Okay. This is why here in the United Kingdom, every year you have to go and have your eyes checked. You have to have, these special tests where they put, all those drops into your eyes and then, put you on the machine to see what's happening with that. So retinopathy is one of the issues that is a big problem, especially in Zimbabwe. It's actually a big problem. A lot of people go blind in adulthood because they are diabetic, and because it's the small blood vessels that are in your eyes that get affected when blood glucose levels are too high. So when those small vessels become affected, they fail to supply the eye.
I see.
Because they normally would burst. Okay. So that is where the biggest problem is. People need to constantly get checked and constantly monitor their blood sugar levels. It is very important. If you can do it daily, do it daily. Just to know, your pattern, how things are going. Do it daily. Understand what the foods that you are having, so that you keep your blood sugar levels within a manageable range, which then does not lead to all these complications we are now discussing. So complications come about as a result of poorly managed diabetes.
Okay.
When you don't manage your diabetes properly, you're going to have these complications that we are discussing. Remember, the complications that we have discussed, we normally categorize complications in two groups. There's the microvascular complications and the macrovascular complications, where you have, macrovascular complications actually involved, bigger, like components like lower limbs, like the heart, like the kidneys. Those will be the macrovascular complications. Then you have the microvascular complications, which involve retinopathy there, and all the other smaller veins that you can think of. So people have got to manage to control their blood sugar levels. That is the most important thing when you're dealing with diabetes. When you're taking diabetes medication, make sure it's helping you, it's achieving the goal that is desired. Question your doctors. Don't just go in there and be told you are going to be taking this medication, so and so and so. Have them explain it to you why you are taking that medication. What does that medication do? You need to have an understanding, because I've had a number of cases where I've spoken to people who have been put on medications, and they're saying, when I wake up, I'm feeling very dizzy, I'm feeling fatigued and stuff like that. So the next question will be, are you checking your blood sugar levels? No, I'm not. I don't even have the machine. That is, there's no machine. A patient has been put on metformin and glycoside, which can put the patient into hypotension. We have patients who are being given, insulin, and they don't have, the blood glucose monitoring machine to check what's happening when they take insulin. And that is also very dangerous, because the hypoglycemia will kill a person. When your blood sugar levels goes too low, it will kill a person.
Which is very interesting, because I had, I think now 2 incidences when it went too low. But you know what saved me, which I was sharing last time, to say I have this machine that's on my arm, like now. So I think 2 days ago it went down, but immediately my phone started pinging to say your sugar level has gone down. And I was saying, I think this is very life-saving in terms of just alerting you. And then I'm wondering now, if we look at the case of Zimbabwe, do you see ourselves going to be able to get to a space where there's proper diabetes management? Because like I told you, from my parents' experiences, they're just on metformin. The only other time when they had the test kits, it's me who had to say, oh, you need to be testing your sugar levels as well. So they're just going on in metformin for I don't know how many years now.
Beatrice, the problem is, you see, in Zimbabwe, the one of the biggest challenges is we are a country that is already struggling with the core healthcare system. So when the core healthcare system is struggling, to specifically focus on diabetes and say, let's try and improve diabetes, is going to be very difficult. Under the banner of the International Diabetes Federation, I have written numerous letters for the past 3 years to the Minister of Health in Zimbabwe to say, I really don't think we are doing enough for diabetes. I really think as a system, as a healthcare system, there isn't enough being done to try and deal with diabetes. So
I'm here. You can go ahead.
Oh, sorry, sorry. So yeah, like I said, I've written a couple of times, and I was trying to explain to them, ways of trying to deal with these situations. in as far as diabetes is concerned, no one has been really forthcoming. Even the Zimbabwe Diabetic Association is not it's there, but not as, it doesn't have this wide coverage of saying we're doing things this way and that way.
Mm.
So I really think what we need as a country is a situation where we try and create something that makes things happen on the ground.
Mm-hmm.
It's good we have people like you, Beatrice. We have me, and I know there are a lot of other people, but it's now up to us to create something that makes things work on the ground.
Mm.
Because most of these diabetic patients are going through a lot. I'm telling you. I know of people who have had strokes because of diabetes.
Mm-hmm.
You see, because no one is paying attention to them. They don't even have, it's unlike here where if you go to a GP, you can walk in and walk out with a blood glucose testing machine for yourself.
Yes. And I think what I've also appreciated is the follow-up care. So
yes,
they don't just, you go there, they give you a machine and that's the end of it. When it's time towards your eye test, they send a letter, you are due for your annual eye test.
exactly.
There's a coordinated system that tracks, even to provide that, follow-up care.
It's because they capture the data.
Mm-hmm.
In Zimbabwe, if you look on the internet and try to find information about how many people are affected by diabetes in Zimbabwe, you realize they will probably tell you 100,000 people.
Mm-hmm.
That's what you will find on the internet. But believe you me, that is not a true reflection of how many people are affected by diabetes in Zimbabwe.
Mm-hmm.
We have more people who are working in Zimbabwe who have started their treatment in private healthcare facilities.
Mm-hmm.
Those people are not captured because who captures? The Ministry of Health captures all this information.
Mm-hmm.
So the 100,000 that we see online
Mm-hmm.
is what the Ministry of Health has in their records.
Mm-hmm.
Why? Because our healthcare system in Zimbabwe, unlike the one we have in the UK,
Mm-hmm.
our healthcare system does not feed into the Ministry of Health.
Mm.
In the UK, you have a system where GPs who are treating you at their various surgeries are connected and linked directly to the NHS system.
That's correct.
So if we pick a patient in an NHS GP practice, that information is already all over the NHS system, and we now have an exact number of people whom we know, okay, we've got 2 million people who are diabetic, which is unlike Zimbabwe, where these figures that we're currently seeing are just an understatement of what is going on, really. So there's really need for establishing, a broad organization. Do you know how organizations like Diabetes UK operate? Diabetes UK is a charity organization, and it helps quite a lot of people, fundraises for a lot of people, and helps a lot of people. That is the kind of platform that needs to be created. Because I will tell you, there are people who are diabetic who cannot even afford to get metformin in Zimbabwe.
That's correct.
There are people on insulin in Zimbabwe who cannot afford insulin. And what that means is then we have a lot of people who are in avoidable danger.